It exposes it for long.
Okay. Enough.
Expose it for long.
Enough, please.
5 pills, 10 doses.
No, we've exposed it long enough.
Sacrifice that one. Please sacrifice that one.
No, we can't.
No, we can't. We cannot. Okay,
that's enough.
Because there is no social distancing in what you're doing currently, please create some passage and step a bit behind. Dr. Alfred, guide us through the process.
Guys, don't be pushing and moving.
Muzungu baba.
Hi guys.
Damu mukubendeza tubikuti. Nisaba kongera mukamu bakati tulabye bulungi. Dakar. Leta basi show us Dakar. Yes.
So, excuse me, she has already taken the shot. Oh, okay.
But they are not
Bambeta Komwendo Judith, ndi nasi nkole mulago mu balwadde ba COVID. Ya olwalero mbadde n'essanyu lingi kulaba at least nange nfunye ku ddagala lya COVID. Ngezaako nnyo okubulira abantu abatanajja kuba those who haven't come as health workers bajja bafune eddagala. Uwa n'eddagala lya bwereere. Ekyokubiri lituyamba protect us. Yeah. Uganda sirimu.
Mpulira bulungi, tewali kyempulira actually. Tewali pain, tewali chi, tewali. Mbagumya bajje babageme kubanga eddagala gyerinza okutuyamba obulwadde gye buli naye nze bava okungema bamaze okungema era abantu bonna mbakubiriza bajje tibagende babageme singa bafuna omukisa ogwo.
You're welcome. You just need to press inside area. Not what?
There are two doctors.
Response to the COVID-19 pandemic. Today, Wednesday the 10th, March 2021, is exactly 351 days from the day the first case was imported and detected in Uganda. As you are aware, the pandemic has caused a heavy death toll, disrupted livelihoods, and rolled back progress in human development like no other public health emergency over the past 100 years in a relatively short period of time. Globally to date, there are COVID-19, and that has shrunk global economic activity. In Uganda alone, over 40,000 COVID-19 cases have been reported and 334 deaths have been registered so far in the health facility, with the country's gross domestic product shrinking from 6.8% in financial year 2019 to 2.9% in financial year 2020. In the absence of very effective treatment options and low adherence to the known public health and social measures, COVID-19 vaccination is the game changer in the response to this pandemic. We now know that COVID-19 vaccines provide the most potent means to save lives, prevent severe forms of the disease, thus protecting the health systems from congestion, reinvigorate livelihoods, and enable the full reopening of the economy. Uganda now joins the rest of the world in the race to vaccinate at least 49.6% of its population. That's about 21.9 million people, including the refugees, with the COVID-19 vaccines in a phased manner. Each phase is planned to cover 20% of the target population, which is about 4.4 million people. The eligible population lies in the age range of 18 years and above. In the context of global pressure on vaccine stocks, the priority persons to be vaccinated is guided by the occupational risk of infection, the risk of developing severe disease, death from COVID-19, and population characteristics, including age, gender, and geographical location. Therefore, workers in public, private not-for-profit, and private for-profit facilities, these are estimated at 150,000, including the support staff. That is what health workers mean. On security personnel, the UPDF, police, and prisons, estimated at 250,000, and these have been at the front line, as you all are aware. We'll also focus on teachers, both in public and private facilities, among other essential service providers, and they are estimated at 550,000. Persons from the age of 50 years and above, who are estimated at about 3.3 million persons. Persons with underlying health conditions, aged below 50 years or from 18 to 50 years, estimated at 500,000. And other emerging high-risk population priority groups, including the airline workers, the media, prisoners, tour operators and guides, bankers, immigration officers, the Wildlife Authority, Revenue Authority, humanitarian workers, and others who will be identified by the Vaccine Advisory Committee. Adequate vaccines for all these people at once, but as the vaccines come in, we shall continue to prioritize them. In phases 2 and 3 of the COVID-19 vaccination program, the ministry will roll out the vaccination program to age groups between 18 and 50 years of age in a staggered manner until 49.6% of the Ugandan population is vaccinated. This exercise will also be guided by the local epidemiology of the disease. Right now, our chief guest, Ugandans are assuming that COVID is no longer with us. But the people in the isolation unit in Mulago can testify that we are still getting cases, and some are severe and they are succumbing. And so I want to remind Ugandans that while we reached our peak and plateaued and dipped, there is a likelihood that we can go into the second wave of the pandemic. And therefore it is important to remain on alert and take care of your health. The COVID-19 vaccination today, the first group to receive the vaccine are our dear health workers. All health workers from public, private not-for-profit, and private health facilities will be the first group to receive the vaccines. This is because they are at the front line, as you have heard from the various speakers, in response to the COVID-19 pandemic and are vulnerable to infection, as has been shown by the statistics of infection. We have over 1,900 health workers who have been infected by COVID-19, 19 of them succumbing to death. It is at this point that I will humbly request all of you to stand up for a moment of silence as we remember those who succumbed to death. We estimate the risk of developing severe disease for an old person above 80 years is about 24 times compared to a person below 20 years of age, while that of death is 7 times compared with those below 20 years of age. Persons with comorbidities such as diabetes, high blood pressure, organ diseases of the liver, the lungs, the heart, kidneys, and cancer patients are predisposed to severe disease and death. As I conclude, on behalf of the government of Uganda, on behalf of Ministry of Health, allow me to thank the COVAX facility, the government of India, and the contributing economies for making it possible for low and middle income countries to get these expensive vaccines only a few months after the rich countries. COVAX facility has taken equity in health to another level in its pursuit of no one is safe until everyone is safe. I would also like to thank the foreign missions, the United Nations in Uganda, whose countries accepted to share the burden and responsibility for controlling COVID-19 with us. I would like to thank the technical teams in the Ministry of Health and partners for the intensive work of developing the national COVID-19 vaccines deployment plan, the training guide, the data collection tools and systems, vaccines and logistics planning, budgeting, coordination, and resource mobilization. Specifically, allow me to appreciate the following: WHO, UNICEF, UNHCR, CHAI, PATH, USAID, CDC, and UNEPI. Please appreciate.
First of all, it is important to know why you're getting vaccinated.
And Ministry of Health has done its best to sensitize all of you about the vaccination. So anybody who is hesitating to get vaccinated should know that your health is your responsibility. Government has worked towards making the vaccines available and free of charge. If you value your life and the life of your loved ones, get vaccinated at the appropriate time. When it is your turn, please get vaccinated.
Abusa amanye nti vaccine eri safe bweba nze nga ndi musawo ndi specialist nsobola okuwaayo omukono gwange ba specialist baffe bonna top cream ya medical fraternity eri wano ez'okugemebwa singa tumanyi nti vaccine eno teri safe tetwandiza okufuna vaccine eno. So kino kyokka kitubuulira nti vaccine eri safe ate ekola. Wadde nga vaccine eringa eddagala lyonna nga bw'omira eddagala n'ofuna reaction kisoboka, naye bakimanye nti eddagala lino liri safe kubanga ligezebwa ate nga likola. So fe abasawo tetwandisobodde kuvaayo ffenna top cream ey'abasawo ne tujja wano okufuna vaccine. Okay?
Both in State House and the Office of the Prime Minister, you are always there and always on time and leave at the end of the meeting. Want to thank you so much. Want to thank you for our political heads that have been with us and working with us and leading us. Honorable Minister, I want to thank you so much for not only just showing the other side of you of selflessness, but also commitment to your country and to your cause. I want to thank you in a special way and your entire team of ministers, the Minister of State. Our Honorable Moriku is not here, but I want to thank you because your leadership has been immense, and at any one time you have worked with us in this planning, meetings, everything. You have not just watched from behind. I want to thank the scientific committee, that's our scientists that have been sitting. I remember these meetings that whether Easter, I remember even on Easter Day, we were meeting. I remember that the scientists would not even say today is a Sunday, today is a public holiday. They would always be meeting. And I want to thank you for your guidance. And I think we have come this way and this far because of your guidance. We value your commitment. We value it so much. We are being applauded, Honorable Minister, but I know that this effort, it is not just the Ministry of Health alone. It is such a combined effort. Big effort. This time round, we just felt the warmth of love, of care, of humanity in this country from every corner. The private sector. We want to thank the advisory committee and the members you put there. The private sector. I know that Kabushenga is seated there, but these are people who have been in trenches with us. We want to thank you so much. And take our appreciation to the entire private sector that has been working with us. To the donors and development partners. World Health Organization representative has elaborated the COVAX facility and how it has started. Without the donation and the support of individual countries in the midst of the COVID, when even all the individual countries were facing the pandemic challenge, but the countries donated and created this COVAX. And want to thank you so much. We want to thank in a special way UNICEF and World Health Organization. These two agencies they are not like UN. They are they are part of Ministry of Health, because whether night, whether Sunday night,
They are in meetings with us. So we really want to thank you so much for the dedication and commitment that you have really shown to service. To our staff, Ministry of Health, to our clinicians, to our medical workers, ranging from consultants to junior doctors, to nurses, to laboratory, to radiologists, to all the team, including cleaners in these hospitals where COVID patients were being treated. We owe you so much. We cannot say thank you. Thank you is not enough. But we want to tell you that your contribution is so valuable. We value you, we appreciate you, and want to say that you are the reason we are here. And want to say we are proud of you, and we can assure you that we shall go and we shall win this battle. Where we are to witness this vaccine, we did not know. In March last year, we had no idea that would be here launching this vaccine. But we are here because you have saved lives. I want to thank Mulago Hospital and Entebbe and the regional referral hospitals where our patients have been, that they bore the whole pressure of the country at the time we were really going through hard time. We want to thank you so much for bearing that weight, and you have shown capable and able and efficient and effective. Thank you so much. Effective and embrace this vaccine. To everyone out there we have not reached, we are beginning with the health workers. We shall go in stages as vaccines get available, because every life matters. We know every life matters, but we cannot access all the vaccines at the time, and that's why we had to go in phases. But I want to tell you that as a country, as government, as Ministry of Health, we want to thank you and want to say we shall get to everyone to receive. There are special agencies, National Drug Authority, thank you so much for quick and expeditious approvals that we received in the country. We want to thank national medical stores that were already in the trenches delivering all the vaccines in all these facilities and making sure that the integrity of our vaccines remain intact. Thank you so much. Allow me, Chair, and our guest of honor, to invite the Honorable Minister to make her remarks. Thank you.